Hi, today we're going to do bed making. We're going to do an occupied bed. If you were to get this skill on your state exam, the evaluators would have all of the supplies laid out for you. They would also have them stacked in order for you to use them. So we'll go ahead and get started with the skill. So I'm going to knock on the door. We're going to identify and greet our patient, our resident. Hi, Mr. Smith. My name is Rita. I'll be your nurse aide today, and I'm going to make your bed. So we have to also explain the procedure, so I would tell him in terms that he understood. So then I'm going to wash my hands. My supplies are already sitting here, and I'm going to pull the curtain for privacy. All right, so the first thing we always do when we're doing bedside skills is we're going to raise our side rails. And then we're going to raise the height of the bed for a good level for us, for the best level of body, for good body mechanics. And that's just so that we don't have to bend over and we don't have to strain our backs. I usually just pull the collet out of the way and pin it up here, just so that in the real world, if you leave the collet there, it gets pushed and then the alarm goes, or light goes off. So I just always pin it out of the way. All right, so then we are going to pull the blanket off or bedspread, loosen the footing, and we're just going to set that over to the side if you're going to reuse it, or throw it in the laundry hamper if not. And so I'm just going to put it in my hamper there. The next thing we're going to do is take a bath blanket, and we're going to cover the resident up and then remove the top sheet. And we're just going to roll that away from us and then throw it in our laundry hamper. All right, so now I am going to move him to the other side of the bed, and I'm going to do that just so I have room to work over here. The skill doesn't involve a catheter, so I'm just going to move it over here. Didn't realize he had one. All right, so I'm going to log roll him. I'm going to cross his legs, and then I would explain to him, and I can use a draw sheet. Okay, I'm going to turn you on your side away from me. And you're just going to try to balance the mannequin the best you can. And keep them covered. Okay, so then we're going to take the draw sheet and we're going to roll that towards the resident. And the whole time we're taking the linens off, we're checking for valuables, sharps, hearing aids, glasses, those kinds of things. We're going to remove the fitted sheet off to the side. And again, roll that towards him. And just kind of tuck it at his back. All right, so now we're going to take the clean fitted sheet. And also it is good to mention that if he were to have soiled the linen, then I would be wearing gloves. But you don't have to wear gloves for this skill. In real life, I'd probably wear gloves. All right, so we're just going to make sure that it's on right side. You don't want it inside out. We're going to tuck it under one corner and then bring it down to the other. And you can kind of tuck it under the mattress too, so it stays in place a little better. All right, So then we will take our draw sheet and we will unfold it and then just tuck the excess sheet material up against his back. We'll just fan fold it down. And the draw sheet should be unfolded, and it should be from the knees up to the head. Smooth it out as best we can for right now. And then we're going to put the side rail up. Oh, sorry. We're going to tuck it under. Then put the side rail up. And then we're going to go to the other side. And we're going to lower this side rail over here. I'm going to move his pillow and roll Mr. Smith over to the other side. All right, I'm going to roll you over. Just place him over on that side. Then I'm going to loosen the bed linen on this side of the bed. And we're going to pull it through. And again, we're taking one piece off at a time and rolling it away from us. So I'm taking the draw sheet off first, putting it in our dirty linen, and now I'm going to take the flat sheet, or the fitted sheet, sorry, and roll it away from me and stick in the dirty linen, and then we're going to pull the clean linen through. So we're putting our fitted sheet on, pulling it through, putting it on the corners, tucking it under the mattress, and then pulling the draw sheet through. And at this point, you can really try to work out all the wrinkles. We don't want our residents laying on wrinkles. It can actually increase risk for pressure ulcers, and it's just uncomfortable. All right, so I'm gonna put this side rail up before I walk away from the bed and come back to this side. Lower my side rail. Gonna move him more towards the center of the bed. And I'm going to put the flat sheet over him, over the bath blanket. Just gently unfolding it. Now I'm going to remove the bath blanket. And we're doing this to maintain privacy so that he's never exposed during this skill. So I'm going to put my bath blanket in the dirty linen. And then we're just going to straighten the sheet out. This isn't in the skill book, but I like to put the blanket on him and then go to the end of the bed to make sure that it's all nice and straight. So I'm gonna, before I leave the side of the bed, I'm gonna put the side rail up and I'm gonna go to the end of the bed here. Again, this is optional. I just like to do this to make sure it's nice and neat. So I'm going to pull the sheet down, make sure it's even. and then pull the blanket down. Make sure it's nice and even on both sides, because we're going to miter the corners, so we want to make sure we have enough material on both sides. So then I'm going to lower my side rail again, because I'm back over here on the side, and I'm going to miter the corner. So what we do, we will raise the mattress and sweep the sheet and the blanket underneath. Then we're going to lift the sheet and the blanket up about right here, and you're looking for a triangle shape. I don't know if you can see it well on the video, but right here, we're going to put that on the mattress and then tuck all this under. And that gives you the mitered corner. You're looking for that crease there. So then I'm going to fold the blanket and the sheet down just to make it look nice. I'm going to raise the side rail and go to the other side and miter that corner. So lower the side rail, and I'm going to do the same. I'm going to raise the mattress, tuck it, the sheet and the blanket under, make my triangle, lay that on the mattress, and then tuck the rest under. And then it gave me a mitered corner. I'm going to come up here and then fold this down and just make it nice and neat. And raise the side rail. So I'm going to make sure that his toes have room, his feet have room to move. So you can make a little toe pleat. Lower my side rail. Now I'm going to change the pillowcase. So I'm going to take the pillow, I'm going to hold it and then just roll the pillowcase down away from me. And throw that in my dirty linen. So then I'm going to take my clean pillowcase and I'm going to almost kind of turn it inside out. And then grab the tag end of the pillow and then just pull it down. That way we're not rubbing it against our dirty uniform, and it looks nice and fits the pillow well. So when we're putting the pillowcase or the pillow under the resident's head, we will put the opening of the pillowcase in the opposite direction of the door, the entrance into the room. Okay, so then he's going to get his call light. I'm going to raise my side rail and then lower the bed. Lower my side rails. Make sure that he can reach his call light. You can reach your call light, okay? Then I'm going to wash my hands and I'm going to report and record my observations. So that's it for bed making, occupied bed making. Thank you.